what's going on, veterans, military members, transitioning service members? Thank you for tuning in to another episode of the Veterans Claim Service Podcast, or better known as the Off the Battlefield Podcast. Today, I'm welcomed by Dr. Luis Lopez. He is a board certified psychiatrist or psychologist, rather, out of Orlando. He does compensation and pension exams with the VA. And is it with Optum or QTC that you do it with?
Both of them.
Okay, so he does it with both Optum and QTC, who veterans you may be familiar with. If you get a letter in the mail or you get an email after you filed a disability claim, probably about 30 to 60 days after you filed your claim, you get this letter where you're going, what is this letter that I'm getting from Veterans Evaluation Services, QTC or Optum? That's your compensation and pension exam, and he is a psychologist. So Dr. Lopez sees veterans a lot, day in and day out, and sees a lot of kind of what's going on. So we're going to discuss that today. Without further ado, Dr. Lopez, welcome. Thank you for joining the podcast. What's up, man?
Oh, thank you for having me. It's a pleasure for me to be here and informing veterans a little bit of what I do, and also like get information out there because there's a lot of things wrong with the system, and there's a lot of things that we can help out, but there's also a lot of things that we can know or can do to avoid the pitfalls that are already on the process of every veteran faces whenever they're dealing with a claim and everything. So I'm excited to be here and get more information for the people out there.
Absolutely. If you're tuning in, make sure that you like, subscribe, comment, hit the notification bell, share this out with a fellow veteran or friend that can use this education and resources here to get the benefits that you, veterans, military members, have earned and deserve for your service to our country. Always, we want you to know that you matter to us, that you're a soul, that you're more than just a veteran to us, and we are here to help you, guide you, assist you so that you get the things that you need. And again, thank you for tuning in today. So, Dr. Lopez, I'm going to kind of get into this. So, tell us a little bit about you, a little bit of your background, and how long have you been in the field of psychology?
So, so my name is Dr. Luis Lopez. Born and raised in Ponce, Puerto Rico, little island down there where they speak a little English and a little Spanish too. I did my doctorate degree in Ponce School of Medicine, and I did my internship and postdoc or residency in Missouri. So I had a lot of friends that are in the field. They were mostly Air Force because we had Whiteman Air Force Base there. But I've been doing C&P evaluation, not necessarily C&P evaluations, Nexus letters and veteran type evaluations since I was in like my second year of doctorate degree. Interestingly, I did it as how do you say that? Phantom writer, is that how you the actual term? That it was another doctor that would be the one evaluating, but I was the one writing it because.
So then you're basically a ghostwriter, or you were the
ghostwriter. That's the word I was looking for. Yeah, I was a ghostwriter for someone else. Like with this doctor comes to me and says, "Hey, I'm getting these evaluations. I don't know what really to do with them. Do you want to take a crack at it? See if we can come up with something?" And I was like, "Sure, why not?" So I kind of learned on the fly. We were getting a lot of referrals from a law firm in New Jersey. It's pretty big law firm, and that's how I kind of started my way into being able to write at like the VA with the nexus statements and proper nexus statements, the more likely than not, less likely than not, equally as likely as not. And that's how I kind of got into groove of being able to do these evaluations. After I was done there, I stopped doing them for a little bit. But when 2021 came up, there was a need. I opened up my own private practice, my own clinic, and I had a veteran come in and say, "Hey, do you do these evaluations?" I'm like, "Heck yeah, I do these evaluations. I've done them." And he was like, "Oh, like the insurance doesn't pay for it." So I try to give this veteran a fair rate for the evaluation. That's what we do constantly. We try to do the most that we can to help out as much as we can. And then I started doing that. Pretty soon after that, I reached out to Veterans Claim Servants, and here we are now.
Exactly, man. Yeah. And one of the cool things, Dr. Lopez, is thank you for everything that you've done. I'm a veteran myself. You come from a long line and lineage of veterans, right? As well, too. And that's very close to our hearts. But one thing that's cool is to make sure that you veterans, if you're listening to this, that you have a safe place or a safe doctor to go to that is not just looking at you as a dollar figure or anything like that. I could tell you Dr. Lopez isn't. And he wants to give an honest, good, fair evaluation to you to put you in the best position. Nobody can ever guarantee that everything is just going to be magical and everybody's going to be 100% and we're going to go on, happy go lucky in life. That's not exactly how everything works. I mean, as a board certified psychologist, he has a job to do. He has to evaluate you properly, honestly, ethically, integrally. He has to look and find out if there's anything fraudulent or anything of over exaggerating. And again, we'll be talking about that a little bit today of minimization. What is minimizing? What is lying? What's the difference? You need to know that, veterans. You don't want to sell yourself short. But Dr. Lopez, thank you for what you do.
Yeah.
You've been a huge help to veterans. You've been a safe place to go. And you haven't been out here charging them $5 gazillion just to run people through,
I actually had a veteran that I saw not too long ago that he brought in a Nexus letter, and I'm reading over it. It's like, this is like a page and a half. I asked him, hey, off the record, because as you said, I do these for the VA specifically too. Off the record, did you pay for this? And he's like, yeah, I paid for that. And I asked him how much, and I was like, oh my gosh, if you would see the ones I write, like mine are at least 8 to 9, 10 pages, and this was a 1-page summary. And he told me that he paid triple, I think it was quadruple what I charge in my clinic per se. So that's another thing that it's very important for you to keep in mind, that there's a lot of people out there trying to take advantage because they know that veterans are quick to act. So they're trying to take advantage, and we gotta look out for the little guy. We gotta look out for the people that don't necessarily know what's the process, how a process goes. And I feel like there needs to be a little bit of a movement for more information out there, for veterans to be more informed how in their claim, for veterans to understand whenever they go to their C&P, what is it that it's important for you to say? What is it important for you to have? There's a lot of things that I can chime in, and we'll probably get into that. But I believe the importance of having an independent evaluation is it's huge, because whenever you have an independent evaluation, whenever you go to your C&P, if you have one, you had a thorough eyes, a person that actually looked at you and actually did their homework, because they're not there because the VA hired them. They're there because they want to do a good job, and you have a fair view of everything you're saying. Because a lot into what it goes in the C&P, it's quick, it's fast. There's not a lot of chance for you to say or not say. It's important for you to know what you need to say and know how to say it. Because if you have a bad C&P evaluator, you're not going to read between the lines. Sometimes it's easy for me, because all the years of experience that I've had, it's easy for me to say, hey, this patient told me that he's experiencing this and this. But between this and this, there's something in the middle that he didn't say. So I'm just looking at the top of the iceberg. So I need to be able to look behind or under. And if I don't give myself the chance to look, if I don't give myself the chance to look, I'll miss it. So it's important for you to have an independent evaluation before somebody that did their homework, that was thorough with you. So you have a baseline. whenever you go to a C&P evaluation, if you get one, it's important for them to have this paper that he was already evaluated by this other person with this license. So no funny business, you know. It's why it's so important for you to do your homework and sometimes invest in your process of it, in your claim, because a lot of people are scared of obviously paying, because not a lot of people have a lot to pay with, but it's important. It's very important.
Yeah, and that's why it's important to have a safe place to go. And veterans, that's what we're here for. We're not tooting our own horn, but this doctor right here has been, you're a great friend. Number one, you're unbiased, you're honest, you're integral. And I've seen you help people bend over backwards. I've seen people get free Nexus letters and stuff like that, you know, and we aren't saying this as clickbait or to persuade you. I'm just telling you, you as veterans, you're going to be hearing this. If you need a safe place to go, Dr. Lopez's stuff is in this description of this. And then also Dr. Prashant. Those are the only two doctors that I recommend for psychology. You know, they both know each other, but they're both very honest, thorough, integral in what they do. And they're going to help you and put you in the best position, you know, and understand how to identify the symptoms and things like that. So talk a little bit about, if you don't mind, what are some pitfalls and shortcomings that you see with the compensation and pension exams? Like, you see people coming in, and I would say, right, you know this better than me, that they're coming in unprepared and just like, I don't know, have no idea what to say or what to answer. Is that correct?
It's funny that the first thing that I ask is, do you know what you're here for? A lot of people don't even know, because in their process, they submitted everything and they have 20 million C&P evaluations for 20 million things. And do you know what you're here for? It's like, no, I'm here. It's like, okay, interesting. So let me look at the orders that they're saying, and from there I go and I start asking questions. But definitely, the biggest thing that I've noticed, and this has to do, and we can sit here and talk about a million things, but this has to do with the system, how it's built, and the system, and from the time serving. Because one of the things I've had, and I've talked to you about this before, I've had people that have been med boarded for mental health reasons because they had one panic attack. And they had one panic attack. They went to mental health, and that led them to get med boarded and got discharged from or separated from service. So one of the things that is kind of built in is you minimize, you don't say anything, even if you're experiencing it. Now there are some conditions that I'm not going to go into that specifically, but maybe another video. But there are some conditions that I can't go back to time served or during your military tenure and go back and create a nexus for those conditions. I can only do that with certain conditions. So let's say if you come in, hey, I'm suffering from this. Cool. I'm going through a divorce. I'm struggling with severe depression. I can't deal with it. I'm completely. I'm experiencing SI, and I want to hurt myself and all these things. Yes, I believe you. Yes. Did you report that during service? The answer is always, most likely than not, no, I did not. So the issue with that is, okay, I can't go back and create a nexus for this condition. So what do I do? Because this veteran is experiencing it. He can pinpoint exact moments during his tenure that he was experiencing this and didn't report it. But like, we can't service connect it, because for the VA, they have this thing that's called presumed soundness doctrine. So the presumed soundness doctrine is that you're presumed sound if you did not report anything.
Exactly.
So if you didn't report anything during service, you have nothing to prove whenever you're out of service. Now, one of the things that when I have a veteran right in front of me is, okay, did you ever receive mental health treatment? No. Did you ever talk to a chaplain? No. Oh, maybe I think I took a class or something, and I think I spoke to someone. Did they write your name somewhere? No. Doesn't count. Maybe it does. Maybe it might be somewhere. But another thing that I ask in your MHA evaluation, whenever they call, hey, I do those. Hey, are you experiencing PTSD or depression-like symptoms? No. No. Perfect. More likely than not, these people are experiencing things, but they're not necessarily reporting it.
They're
So whenever
minimizing.
you're at discharge and you're trying to get your due diligence with the things that you are fairly should be service connected for, because you experience them because they are due to military service, we can't do anything about it. So that's it, my man. So I believe that's one of the, if not the main thing that I've seen in doing these C&P. And yeah, like what do you think about that?
Yeah, because you have to understand, veterans, what Dr. Lopez just said is you need three things to prove service connection. You need in-service treatment and a stressor. So what happened while you're in? And then treatment. Did you actually go to a board certified psychologist or a psychologist on base or a mental health clinician? Was it documented, and is it in your active duty records, or did you get a line of duty, an LOD of your National Guard? Is it in your service records from whenever you were in? And you need to establish that, because veterans, you're never going to be able to prove something or a stressor if you never reported the stressor. How are you going to do that? That's like trying to report a car accident, but you don't have the accident report. You can't show pictures of the car. You have none of that, but you want to get paid from Geico or Allstate or something. It's not going to happen. And that's what you're talking about. And that's what the VA is saying. They just presume that you didn't report it, you're fine. And it sucks, because us as veterans, it's frowned upon to go in that sick call line. You look like a dirtbag if you go to mental health. If you, God forbid, you go and get treatment, and it's not very welcoming. And I get it. We're there because the mission is first, but also as a whole, we have to understand that men and women have died in this line of duty, and that when not everybody's going to do 20 years or whatever, right? And when people do get out, they have a life to live, and they have their mental health and their body and things that need to be taken, care of. They may have symptoms that are going to, show up 5 or 6 years after discharge from service. So, veterans, if you're on active duty right now, I cannot tell you, get treatment for anything that you're experiencing or going through. Make sure that you do that. But veterans, we'll get into this in another video, but there are other ways that you can prove mental health, right? If it's not in your active duty file and you get denied for PTSD because you're trying to claim a stressor, or MST or something, and you don't have an incident report, and it's not in your C file, your service treatment records, or your active duty records, Dr. Lopez cannot go back and service connect that, because number one, he wasn't your treating doctor when you were in. This is post duty now that you're seeing him, and you didn't report it while you're in. So if he did that, that would fall on him, and he'd just be making something up. He doesn't know what you went through 10 years ago, 20 years ago, or 2 years ago. Yeah. That's why you veterans are your best advocate. No matter what anybody says, you have a right to go to sick call. You don't need to feel like a dirtbag. You need to get the help that you need. You need to document and report all your symptoms that you have, because I tell you what, when you go, or while you're in right now, or as a veteran, there is somebody coming into the service at basic training, boot camp, or whatever now, and leaving the service. Yeah. So, essentially the way the system works is we're all just a number, Yeah. We really are. Dr. Lopez and I look at you as a human, and we're very thankful for you as a veteran, but people are coming and going, and there's a mission that needs to get accomplished. Yeah. But during that mission, veterans and military members, transitioning service members, if you're about to file your claim, document, complain, be honest, don't over exaggerate, but don't minimize.
Yeah. And right? I feel like it's another thing that's very important that I feel like should also be addressed is, if you hear something in the background, my family's here. But one of the things that I have noticed is that it's important for veterans to do their homework before they start their process. because whenever I get somebody in service for an evaluation, I look at the benefits and the different determinations. I see everything. So I see all the determinations every time you've applied for let's say for a mental health reason. I see that you applied for anxiety, then you apply for and that one's denied. Then you apply for depression, that was denied. Then you apply for PTSD, you didn't have a stressor, that was denied, or it was deferred. And then you come back and you tell me, hey, I experienced an MSD, like MSD event. You already tried that you already tried to submit something 3 times.
And it didn't work.
You didn't report the MSD in those 3 times. Now the 4th time that you've tried so many other times to get this service connected, now you're trying to do the MSD. I'm not saying you're lying. It might have happened and you didn't want to share it, but now you have a track record of trying to submit something and it getting denied or getting deferred. That's why it's important for you to do your homework before you do everything. Be able to evidence it. And another thing, the service after you discharge is, I think it's vital. It's not only vital, I think it's one of the most important things whenever I have somebody in front of me, because you're seeking compensation, right? It makes sense. You went through the process and now you're done, and you're now you want to get the benefits that are entitled to you. That's perfect. If it's significant enough for you to feel like you need compensation, it should also be significant enough for you to feel like you need treatment. And I understand there's a lot of minimizing that's in the system. There's a lot of minimizing that is in the military, that we don't share, we don't do this, we don't do that, we don't go to mental health. That persists into after discharge. But when it's after discharge, that's when you're supposed to go to the VA and say, hey, my foot hurts. and it was hurting since then. And even if you're not necessarily looking to get a claim for mental health, it's important that you update your medical records, because things can change. So yes, if things change, you have a good timeline of you getting service, you getting treatment, because out of the blue now you have depression. Now you say it was because of this. It was because I had a medical condition. I've been dealing with pain for 10 years and now I have depression. It makes sense. It can be service connected because it can be a secondary condition. But the thing is, you've been reporting pain since what? 20 years? Now you're trying to get the mood behind it. And that's what I'm trying to get people to understand. Get treatment. I always tell all my veterans, I try to help out as much as I can, but obviously there are things that are out of my hands. And the best thing you can do is update your medical records. Go to the VA, go to your like a community psychologist in your around your house. Go somewhere at least once a month, telehealth, 15-20 minutes. It's enough. You need to evidence that this is significant enough, and it's been significant enough for the past 20 years or the past 10 years or the past 3 months. Evidence it, because you just saying it sometimes doesn't cut it. We need something around it. We need the markers to say this is significant, so I should do something about it.
Exactly. And without treatment or evidence, you don't have anything, you know. And veterans, nobody can force you to go see a doctor or pick up the phone or any of that, but you need to. And also, if you need some free resources for counseling or anything like that, there's the Camaraderie Foundation.
Yeah,
right.
I can talk a little bit about that if you'd like.
Yeah, absolutely. Yeah. So Dr. Lopez is part of the Camaraderie Foundation. I guess we both are, in a sense, of referring people there and so forth. I've been to counseling through them as well too, for PTSD and stuff, so my thing is, let's talk a little bit about it, and what it offers.
So it's interesting that I didn't know about that until not too long ago. Well, not too long, I would say a little bit under a year, but it's getting to the year. A veteran that I was evaluating fell in love with the way that I was doing the C&P evaluation, her C&P evaluation. She was like, oh my gosh, Like, can I see you for therapy? Because I try to see the human side. I try to get them to feel validated, because it's a lot of things that they just don't feel validated. And she asked me, do you take insurance for therapy? It's like, I do, but I don't take the VA at this time. And we're changing that, but I don't take it at this time. And she said, oh, like I really want to see you for therapy. I was like, we can do self-pay. I can do a payment plan. I'm very flexible with being able to provide the services that are needed. And she's like, oh, do you partner with the Camaraderie Foundation? I'm like, what is that? Yeah, the Camaraderie Foundation pays for services for veterans. I was like, interesting. So I reached out. I got in contact with Ruben. He's the counseling director. So how it works is that a veteran applies. A veteran applies, but that's crazy that not a lot of people know this. But if you're a family of a veteran, if you're the wife of a veteran, you're also approved.
Yeah.
If you're a child of a veteran, you're also approved. If you're the former spouse of a veteran, you're also approved. If you want couples therapy, you're also approved. If you want spiritual counseling, you're also approved. If you want all of the services that I just said, you're approved for all of them, up to 12 sessions, for completely free. Yeah. They pay for it, because there are people out there that are wanting to help, are wanting for you to get services accessible, and are wanting for like veterans to get better, because at the end of the day, like, you guys serve this country, and there should be stuff out there that are looking out for you. And I'm it's crazy how not a lot of people know that camaraderie exists. Now people need to reach out to them if they want to come to me for therapy or my clinic. I have other providers that I employ. We do the counseling, the couples counseling. We do the spiritual counseling, because Rafa Family Center, we're a spiritual or a Christian faith-based organization. We do the normal individual therapy. We do so individual therapy, couples therapy, spiritual counseling. For children, my wife's a pediatric psychologist. She's starting out in August. She's going to start working in the clinic as well. So we're going to be able to provide all these services. And if you're a veteran or family or related to a veteran, it's going to be completely free for you, up to 12 sessions. If you do once a month, that's a full year of therapy. Yeah. What's a full year of free therapy out there? That doesn't exist.
Yeah. And you get the documentation and the notes and all that stuff that you get, which is, more of a track record and records and evidence to have to say, look, I've gone, because veterans, you have to remember that, or if you're applying for VA disability benefits, that mental health is subjective. It could get better or it could get worse. Some people have some bad experiences while they're on duty or deployed, and they get out 10 years later and it's gotten a lot worse. So, then they start having these flashbacks and aren't sleeping good, or they have a panic attack in the middle of their work and they're a supervisor, and all of a sudden they got to stop working. Like, it's happened to tons of veterans.
I actually spoke to a veteran not too long ago. I met them in a restaurant, and I was asking him, like, do you have any service connected conditions? And are you no, he's like, no, I'm good. I have some records about my knee and something about my back, but I've never wanted to do anything with that. I've never pursued it, and because I'm good now. And I told him, perfect. How old are you? You're 26. Oh, awesome. You're 26. Give me a call when you're 35. Give me a call when you're 46.
Yeah, and then tell me how you're doing.
Then tell me how you're doing. You have the ability to be able to help yourself with that and have the track record of services, but you're deciding not to. So you're not always going to be where you are today. So it's important that you act today, act now, and do your homework and do whatever you need to do to help yourself. Because again, you serve this country, and I'm not saying that we're lying here. I'm not saying that we're embellishing. We're just doing our due diligence with the things that we experience, or not we, as like you as a veteran, you know, during your military tenure, what is rightfully yours. So it's important that you do your homework and move adequately and in an informed manner.
Absolutely, absolutely, and that you get the help that you need. And veterans, nobody can force you to go, you know, and things like that. But veterans, remember, you know, this is a lot of people call it disability. I'll talk about this in another video, but it's really replacement income. Replacement income is, look, if you got to take off of work, you know, and stuff, and you got to go to physical therapy appointments for your back, or you got to go see Dr. Lopez and all this stuff, and it starts taking away from your job and your work. And that's why VA disability is based off of occupational and social impairment. Those are a lot of the factors of how are you impacted your quality of life? How are you impacted occupationally and socially? How bad are your conditions? The worse your conditions are, the higher the rating. The more severe, the higher the rating per condition, you know, unless a condition is capped. You know, you need to make sure that you have that care and that you're doing that. But this is, if you don't advocate for yourself, you're never going to get what you need. And then guess what? If your back hurts and you're 26 now, but it's 40 and it gets worse, then guess who's got to go get that taken care of? You. And if you haven't filed your claim or you haven't done anything and you're a veteran, guess who's got to pay for that or come out of pocket or hope that your insurance is going to pay for it? And as the years go on, if anybody's not noticing, insurances ain't trying to pay any more than they need to, neither. You're going to have to pay for that. And if things are covered by the VA, then those things will be covered down and you'll get the help, the treatment, the medications, and all of that stuff. And veterans, the worst thing that somebody could tell you is no. And another myth and another lie is that you're taken away from the next veteran. That's not true at all. You know, you need to know what you have going on. You're your best advocate. And again, like Dr. Lopez said, there are resources out there, and this channel stands here to provide and to fill the gap of the information, education, and the resources that are out there, because I think there's resources so much out there, but people just, veterans, we just don't know. Mm-hmm. We only get a few of them. You know, we hear about Wounded Warrior Project, or we hear about a couple of places, and that's it. And there's just from Simplify Fund to Camaraderie Foundation to, you know, to fishing, to events, to faith-based organizations like Veterans Claim Servants, you know, to doctors that ain't going to screw you over to make sure that you're getting help and put in the best position. You know, all those things are out there, but veterans, you know, you got to do your research as well too. And we really hope that this video and that this stuff right here helps you if you're going through the VA process right now, or if you're in need of counseling or anything like that. The Camaraderie Foundation, the link specifically for like Dr. Lopez with the Camaraderie Foundation will be in the link of this video. If you need a DBQ and a Nexus or anything like that, he can, you know, you can reach out to him and then he'll review your medical records and stuff and see if he can do it. You know, so, hey, I want to move on to this topic here, before we kind of close out, you know, but what do you think can be done better that you've seen as a compensation and pension examiner, and doing some independent evaluations? What do you think could be done better on the VA's part to help veterans not be so confused by the system?
I think this is, I don't know if the VA or the DoD is the system that we gotta change at some point. Maybe legislation, maybe I don't know, but definitely is informing service members from the get-go that if they're experiencing something, if they're dealing with something, to report it. I know it sounds like a pipe dream. It sounds so anti status quo how it is now. I know like going to boot camp, it's like everybody's gonna report something already. You know, it's but I feel like the stigma behind services, the stigma behind, you know what, just be having a little anxiety, having a little panic, having a little sadness, the stigma that's behind that, I feel like is where we should start trying to act. And I know it's it's easy for someone that's not experiencing the things that veterans are experiencing to say, but I feel like for change to come, it needs to come from above, and say, like, you know what, it's okay for you to feel this way. It's okay for you to report something. It's okay for you to say that you need services that like I had in my schooling, they offered free services, completely anonymous. You didn't have to say anything. You didn't have to tell anyone. You just went in, you talked to someone, and it was reported. It didn't go into your quote unquote permanent record. It wasn't anywhere, because it's providing HIPAA compliance. For you to receive services, you don't necessarily need to tell everyone. So being able to change the system in a way for access to services to be clearer or more accessible during service time. Also, at the VA, I would say, whenever you discharge, have case managers track this, because we already know that veterans experience these things, and sometimes they go unspoken, or they're excessively spoken. So having specific personnel that are dedicated to follow veterans. I don't know if that would be too much on the taxpayer, but follow veterans here and there for them to have a clear view of a clear path of how to do a claim, how to, like, what's needed to be said, what is being looked at. Do you qualify for this? Do you don't qualify for this? I believe there are things that can be done. There might be hard to do, but that doesn't necessarily mean that they cannot be done. Like, I feel like changing the way that information is given out. It's not up to the veteran. I don't feel like it should be up to the veteran to seek out information. I think it should be up to the system to provide some information for the veteran to be knowledgeable. And the veteran has to do their homework, their due diligence, to do the things that they're required. So it's kind of a little bit of both. And I'm gonna
So with me transitioning not too long ago, I'm gonna say, and this is my 2 cents here, and from what I've seen, is definitely the systems that are in place, but it starts in the military. That's when your disability and those different things do start. But we have to do a better job of not just throwing people to the curb and service members to the curb and just treating them like dirt, and feeling just like a number, like, so we have to do a better job of taking care of one another while we're in the service, because while we're in the service, a lot of stuff would be mitigated if people were allowed to or felt welcome to, be able to go to sick call and didn't feel like a dirtbag or a sham artist. And then also, when you get out, why are we doing dumb details before we get out 2 months and we're about to change from military to transit to civilian life? This is a big night and day difference for this veteran. Their housing allowance is about to not be paid no more. They're coming off of a regimented schedule of right place, right time, right uniform, to where when you get out, you ain't got no platoon leader or squad leader or platoon sergeant that's coming and saying, hey, you got to be up here at 5 o'clock formation or anything like that. It's up to you. The ball is in your court, but that's too late. If we get out, we need to do a better job with our transition assistance programs. And I'll talk about that in a later video, but they suck. They're terrible. We are not doing a good job. There are veterans in 2024 that are getting out of the Navy and other other branches of service, and don't even have DD-214s, and they aren't even getting all their records. Like, they're just getting thrown out for a medical injury, getting washed under the rug, not even getting a proper med board, a medical evaluation board or physical evaluation board, because they've been labeled a dirtbag, because now they have an issue and they're just like, all right, see you, let's get them out of here. Like, why would we do that? That's what's happening. And then you have people that are coming out here. So And I think to prove the point here is look at our Vietnam veterans, look at our Desert Storm veterans. Look before we've gotten better with technology, and we've gotten to where there's more computerized systems and electronic records, but those veterans don't have a fighting chance because they ask for their medical records and they're like, what medical records? I was in Vietnam, got dropped off by a helicopter and was walking through the fields of Da Nang getting shot at. You're talking about going to sick call? Like what sick call?
Yeah.
Like what transition? What was PTSD back then? And then they just suck it up and live with it and deal with it. But our transition assistance programs could mitigate a lot of this if we invested time into our military service members and said, hey, get the help that you need, rightfully so. We're not saying lie and let's beat down the system.
Of course.
But if you're hurt and you have a legitimate issue going on, get taken care of. Get
your homework.
Dude, because that would, I guarantee you that would help with some of the suicide numbers as well.
No,
too.
I totally agree. And not only that, have something in place that provides like what's behind, or not what's behind, like the actual symptoms. Because I've had a lot of people that when I look at their medical records, I'm going down, it's like, oh, wait, look, you have Agent Orange exposure. It's confirmed. You were at this specific base that was filled with Agent Orange. Okay, cool. Are you experiencing any cognitive complaints? Yes. Is that service connected in any way? No, not at all. That's it. That is something that not a lot of people know. If they had exposure, let's say if they have a service connection for cancer or a service connected for this, and they have a Agent Orange exposure, and they're experiencing cognitive complaints, you could get dementia service connected if you're experiencing that. But that's a little bit into like an older folks. That's my specialty. I specialize in neuropsychological evaluations for patients with dementia, but it's something that not a lot of veterans know, especially older folks. But if you're exposed to this and you're experiencing PTSD like symptoms, cognitive complaints, it can be service connected. Also, PTSD has a cognitive component. If you don't necessarily have all the clear symptoms for PTSD, that doesn't necessarily mean that you don't have it. Maybe you have other symptoms that are not necessarily clear cut for PTSD, like nightmares or flashbacks. Maybe it's more cognitive complaints that you're experiencing, and that can also mean a PTSD diagnosis, even though you're not showing nightmares or flashbacks. So that's why, going back to what I said at the beginning, it's important for you to get an evaluation or an independent evaluation, because of the person's going to do it's going to be thorough. They're going to do their job. They're going to actually look at you and actually look at what you're going through, what you're experiencing, all the factors that can be related to military service. It's not just an order that it's giving. Oh, look, evaluate fully for depression. I don't see any depression. No, check, next.
Yeah. Yeah. And another thing too, in comparison to independent medical opinions or exams as opposed to C&P exams, it's less payment from the C&P exams to the provider probably too. So it's like, in some ways people are coming through more. So not every examiner is getting a good thorough look. And if I'm not mistaken, a lot of the VSRs are not giving every single thing that the doctor needs, or even that the veteran submitted with their claim. So if the veteran does not come with all of their documentation to their compensation and pension exam and say, hey, Dr. Lopez, do you have that outside medical opinion from Dr. So-and-so? Or did you see that Nexus letter or that DBQ? Did you look at my Beck depression score that was submitted with my 50-page packet? Did you look at all of that? And you're like, I didn't even get that. What are you talking about? Or let me look at it, because some people are just flying through. They're getting ready to go to the Bahamas tomorrow. Some people got a major caseload and are 100 veterans behind, and the VA's, hitting them up, or the QTC Optum or VESs, and saying,
Oh, yes.
we need you, and we need these claims back quick. Come on. Like, the workload is high, and it's hard for these companies, QTC, Optum, VES, right, to find doctors like Dr. Lopez and stuff like that to do your evaluations. And we'll get into that, but that's a lot of the times of why people are waiting after, for a C&P exam and things like that, because there's more veterans than there are providers.
Yeah.
Let me just put it to you like that, because these providers like Dr. Lopez and so forth need to be educated on the 38 CFR, what DBQs are, how to fill them out properly, what Nexus is, and all of that stuff, right?
Yeah, it's funny now that before we end, I had a veteran come in. I think it was 2 days ago that he comes in and he shows me a DBQ that was done for him. And again, whenever they come with a lot of things, I ask them, hey, is somebody helping you off the record? And he's like, yeah, somebody's helping me. And I ask, like, who is it specifically, or like what who are you using to help you? And one of the things that this specific veteran is, he gave me a DBQ that was for a review. And he was doing an initial. It's like, this guy didn't do the right paperwork. It's like, and it got denied. It got denied.
Yeah. Oh yeah. A veteran, like, that happens to so many veterans where they're looking, they're like, oh, I got a Nexus letter. I'm like, are you sure that you got a Nexus letter? Are you sure it was a proper Nexus letter? Who wrote it for you? Oh, just a doctor that I see. Like a Nexus letter is a research paper. There's no medical or scientific literature in here. You're not proving how something causes something to establish service connection. And this person said nothing. Only thing you got on that paper is diagnosis. That's not a Nexus.
Yeah.
So veterans will get into that. What is a DBQ? What is a Nexus? How do you prove it? There's so many different ways, but veterans, make sure you ain't getting gypped over. Reach out to Dr. Lopez if you need a Nexus or DBQ. Reach out to Dr. Prashant if they're busy, reach out to one of them. I'm telling you, they know what they're doing. They are not going to screw you over. They're very fair. They're not charging $1 million for a DBQ, and an arm and a leg. They're there to help you to evaluate. If they can't do it, they're going to tell you, look, man, you're barking up the wrong tree. They're going to be honest with you, but they're going to do what they can to put you in the best position, honestly and integrally. And that's what you want, veterans. So, anything else you want to say? Me and you'll be on some more episodes, and I can't wait. But we aren't going to pull all the magic tricks out the bag right now. But there's a lot of information and knowledge that Dr. Lopez has, that I have, that veterans you need. So, is there any last words that you want to leave with anybody listening?
Yeah, I would say update your medical records. Reach out to us if you want to have like a proper humane look at your C&P process, at doing an Nexus letter. Also reach out to us if you'd like to have treatments for me, from any other my other providers. I have around 4 providers in my clinic already, and hopefully we're growing fast. So we'll probably have more people to see veterans and other people that come in. At some point in the future, I'm looking to open up a foundation to see if we can provide services for people for free. So that's treatment, and that's C&P evaluations. I mean, Nexus letters and DBQs. Hopefully that's gonna happen next year. Obviously not. We're so wait, but stay on the loop. There are things, there are resources that we're trying to establish to help out as much as we can, because that's the whole point of this, is helping out. For me, that's my way of serving, because I didn't serve. All my family did. All my grandpa did. He's a Purple Heart. My father, my uncle, I have everybody in my family served. And for me, this is my way of serving. So I want to do the best that I can to the best of my ability. So reach out and we can get it going. We hopefully help out as much as we can. And I can get people where they need to be.
Absolutely. And we'll be keeping you up to date on nonprofit stuff, on grants, on things like that, because there's veterans out there, and we've had the opportunity too, through like grants and things like that, to be able to help homeless veterans, and I've been able to say, hey, you need to talk to Dr. Lopez, and they've been able to be taken care of. So veterans, reach out if you need anything. I can give you the information for Dr. Lopez and things like that, or Dr. Prashant. It's also in the description of this video as well too. Again, you can reach us at info@veteransclaimservants.com. Just thank you for tuning in. There'll be more episodes, more education that Dr. Lopez and myself will be given. We just want you to know that you matter, you care about us, or that we care about you, rather, not just us. I said that wrong, but I just want you to know also, if you need an online community, every Wednesday, 7 a.m. to 8 a.m. Eastern Standard Time. The link will be in the description of this video. There's a Unity Hour. Come get encouraged. Don't fight this fight alone. All you got to do is jump on your phone, and you may get some encouragement or words of affirmation that you need to continue to push you over the hump and get you through the week. So join us. It's absolutely free. Come on in there. I mean, our goal is, we love helping people. Like Dr. Lopez said, we are here to serve, to be servants. As you can see, veterans claim servants. We are servants. And that's what we want to do. Yeah, exactly. So like, subscribe, comment, share this channel out. If you think it can help someone, tap the notification bell so that you get alerted and that you stay in the mix for more awesome videos like this. And just again, thank you for your service. You matter. You're important if you're listening. And Dr. Lopez, thank you for your time and jumping on.
Yeah, send this video to someone. Somebody's going to get blessed by it.
Yeah, absolutely. So again, thank you so much, man, for talking about DBQs, Nexus letters, a little bit about the compensation and pension exam process, which is daunting to a lot of veterans, and just a lot of the shortcomings that we see. I appreciate that. And thank you for jumping on here with me, my brother. And veterans, military members, transitioning service members, you are your best advocate. Take care of yourself. Document, document, document. Get the evidence. Do not be afraid to speak up, because if you don't, who will? If you don't, who will? So thank you for tuning in. Until next time, Dr. Lopez and myself, we are out. Thank you.